Fambul well, on a good evening and welcome to the Wel Bodi Tok program where they come to you live from Radio Maria Salon, the Christian voice. Now you host with me, Gifty Masakoy. And with me today again is special guest because this is the month of October and a breast cancer awareness month. And I get me special guest with me today, we're Khadija Kone, we're a breast cancer nurse and also a survivor. Khadija, you can tell people I do.
Yes, I do, and thank you for getting here today.
Okay, me say happy for get Khadija today, and I continue for say sorry for that we start late. I know say people don't keep waiting for the 4 o'clock as usual, but we get so many things along the line. So today you find out say we they broadcast directly on Facebook because other activity they go on the beginning and get quiz. And Khadija said we get an emergency in a sense, as I don't say in a breast cancer nurse, you get patients at any time where they can call them and he willing and passionate but in job and he always ready for give a helping hand. So that make it late small. But we appreciate him so much for spare those few minutes with we. Actually not gonna take the 1 hour today because from here it gets another place for go and help for sensitize with the woman. They will go and know waiting, make them say thinking pink. They work with Thinking Pink Breast Cancer Foundation. So that makes it they are even try for fan pink for la way. And you can see Khadija say get pink na so we did so for let you share your experience with we with cases them way you don't deal with and for talk to we the woman them because pink we know say it's specific to we woman them and pink also sweet, but yes the negativity of them is that some of we too timid, we they fear, we they in denial or we inexperienced and try for fail for realizing breast cancer is real. So I make Khadija denial today for help we. So inside this program we go know waiting at the mission for Thinking Pink Breast Cancer Foundation. We go try for know something little bit but we Bobby and waiting a role where they play. Then you go once for ask if the man themselves get role. Yes, the man them actively for be involved in this. Then waiting at the signs and symptoms them waiting with you go see and waiting you not go see. When I pass you go meet the master sabi people them for maiden check and able tell you say na this na the problem. Then waiting they cause them. The other day at risk. All this day inside the program, also you go for help and how you go able for preventer. Now that make Khadija day with me now today. Gifty Masako. Khadija, I hand over to you.
Okay, thank you very much, Ma. So breast cancer. Okay, let's talk about the foundation. We start a comment. So this foundation, we're not Thinking Breast Cancer Foundation. It came about in the year 2012. So this year make we 10-year anniversary where we celebrate.
Oh,
yes,
wow.
10 year we did inside this business here for raise awareness and sensitize people about Bobby. We they help raise awareness, we they go now outreach programs them and for engage panel sensitization campaign them, for tell women the importance of early detections and breast cancer or Bobby cancer, and also tell them say if you detect them late then they be dangerous because late detection can make person can die from cancer. Okay. Especially when a salon we get limited treatment facility for cancer especially. So the best chances we get now when you detect them very early. So we help raise awareness and also we help engage fundraising activities them. We realize about women then they delay for the treatments them for take because the money no dey. So we help them raise money. We can go to various individuals, organizations, governments, both private and even international them. People them for help raise money them. We also establish a spa where women them can come when need care and comfort, make their nails fit. We get people them we sabi for manage because when person they receive cancer treatments them their hands and nails then become much more sensitive as compared to the normal person. And person also we train we able massage. We were able to help for relief of tension them and stress them. So we engage them boko activities them. Yes.
So now that's Thinking Pink Day all about. So I want to congratulate you now for 10 good years. If that pikin self you don't born 10 year pikin, at least you go down try for go from one by now. So now don't achieve so much. So we go on know because I can always tell women and say we can allow na demand them no but we pass how we know but we say. So go on no little thing but the Bobby and waiting normally na the Bobby in work.
Okay. Wow, Bobby, eh? Oh, now it actually they make the woman, eh? Because you know when we they small little girls, then when they grow up, you they see some girls and they put tissue on their chest for make let's say they get Bobby, and even then when they get Bobby, it they signify womanhood, you know, or puberty on the young girls them. So basically, Bobby na for beautify you as a woman. Bobby na a role for a breastfeeding, for give Bobby milk to pikin the way you born, or even you did not other person pikin them for produce Bobby milk, and also for the pleasure. They say because it connected to the reproductive organs, then right? Actually, Bobby are part of reproductive organs, yes. So now in that.
So now in that we don't know waiting now with Bobby and waiting now some of the old way they play. So we dey go now really to this thing where psychologically they ambog woman them. And I know say like where this program they go on. The last time we talked something on picking the young cancer. Most people while they come in contact with say no way you the name no more cancer and heart don't put a because in person die of and all the rest of it. So that stigma attached to them. So man, as you want come up with that talk, you know even think say you need for learn more about that. So we go one let you explain to people that waiting now this breast cancer and waiting really now the statistics. Not only for the whole world, but the statistics, na salon says it.
Na salon, yes. So breast cancer na simply cancer of the body. Now where body get cancer. We say cancer they can affect any part of the body. You can get like brain cancer, bone cancer, blood cancer. But we say based on statistics worldwide, breast cancer na can top pan the diagnosis them and I can top pan the deaths them. And the cancer them. And Salon, we get an organization where they call Global Can, you know, and they work with the cancer registry in Ayana Salon attached to the Ministry of Health. They don't get a statistics for the year 2020. They say inside that year 4,000 cancer cases then be done be record, and out of that 4,000, 3,000 of them people that we don't diagnose don't die of cancer.
Wow.
The rate of death is alarming. It shows say because the country in a middle or low income country, we lack facilities them, treatment facilities, drug medications, life-saving drugs them like chemotherapy them for patients them, radiotherapy, but current treatment them we lacking. We even they lack specialists them in the cancer area. Myself, I just come in after I trained inside the year 2019. I just begin work inside 2020. And today I serve me people them. And so yes, so cancer now, Bobby cancer now you can top and it's very, very dangerous. And then why people they die besides the fact that facilities are not there? Because again, people don't get knowledge. The awareness not being there, but we thinking pink we no relent. Since the past 10 years where we don't begin till now, we engage from boku sensitization campaign. We go schools, we go markets area, we go corporate institutions, we go deprived villages them and deprived communities them. Because we see say pan with data, people they come up all that end. And we see say the number is actually high pan the young girls them.
Wow.
And women them between the age 20 to 40. Boku they don't can they diagnose them, you know, and that's why we say cancer no get respect of age, in no respect of gender, because man self can get cancer, although it's rare, but it can happen. And because man the way they can get Bobby issues them, right? Because they get Bobby but a flat, but they can get the same signs and symptoms like the woman they panic cancer them, right? And because Boku woman they don't know the signs and symptoms and they Boku, then they about 10 different signs and symptoms for Bobby cancer, but they only know one when I'm long. And I can see Boku woman them where I can look at them Bobby, it don't look go far from the spread. I can ask them, you don't notice? They say I don't feel no long. Then I say, what do you see? Some they say what are they come on at the Bobby they arts or Bobby they swell or Bobby don't begin get thickness or they warm. You know, all them signs them, if them Bobby moths don't begin make like if they go inside them, all them signs and other signs of cancers them. Unfortunately, other Bobby sickness than they, but they get the same signs and symptoms. So it's very important if anybody detect them signs and symptoms, may they come forward and check. We did 32 Panema Road and I think keeping Breast Cancer Foundation, you can even condone a cannot. Or go to other clinics than where you sabi. Make sure they check your Bobby and make their order for test. Because diagnostic, yes, we able to diagnose cancer. But again, if we are aware of the signs and symptoms, we able to identify them quick when they happen.
Wow. So with all what you don't say, in as much as they fit the timing, I want let you take you time for me, the woman them, the man them, understand the signs and symptoms, waiting then they see and waiting they not go see past them go meet one of the master sabi people them for tell them. So let we pay attention to the signs and symptoms, since you don't say early detection they save life.
Yes, correct. So the signs and symptoms them is very universal, right, among women and men, huh? So basically for the woman, they when like they can see their menstrual cycle, not during the period now the time then where they can notice really signs and symptoms where they for reports. Now after the period, then 1 week. Now we all know lump, now the bobby, now the popular signs. This lump then when I like seed, it can be different sizes, but all the lumps then they begin small, then they grow, they grow. Some they grow fast, some they grow small. If you like limb, now the bobby. Yes, it hard back. Yeah, sometimes it can get pain, sometimes it no can get pain. So nothing say where you know they get pain, not to nothing. Nothing say because the place no they warm, it no mean nothing. You need for report. Then pain na the bobby. Whether you no get lump or where you get pain on one side na the bobby. Not so where you wear that tight brace where they give you get one or no. Like where you remove and then you still get the pain after your period. You get some during the period. You get some report them. Then where bobby get difference in size, right? We all know say one bobby can be small normal. In fact, you not even notice the difference. But if you say the difference is too much, that is not a good idea. Then now the shape of the bobby, right? We almost say, but so the two bobby for people like they say are identical twins, right? But you see, say for example, the two bobby in the middle orange, then one don't begin take the shape of banana, not so good sign for reporter. Then the bobby moths, you need to watch the bobby moths. If now you grab your bobby moths, it make like it go inside, no problem. But if all along you know say bobby moths it out, then all of a sudden you see one they make like it go inside, or it can even be two bobby moths they go inside, not a good sign. Then the bobby kanda, you need to watch them. If it change color, if it make light or dark or even redness, that is not a good sign. Then if the bobby kanda, if you were like that orange peel, now the orange kanda don't in a season, right? If you get that boku dots, or even if you person gets like, for example, some people they can get dimple or bojo, that's what they call it.
Yes.
If it happen at the bobby, it's no good, not a good sign at all. And lastly, these boku people can miss out a lot. The bobby moths where they pull water. Now, another say when you na combra or you na belly woman, they one and normal. Some women say when also combra and belly woman, they can get bobby water where they come out. But now the color you for watch. Okay. If you make like blood, like where they cut yourself blood. If you make like brown, like with coffee and tea where they drink. If you make like snot and if they draw, and if they get bad smell, then it's not a good sign. You need to report them as soon as possible, right? Sometimes, most of them signs them together, they can then one bobby you can see. Sometimes are just one signs them normal person can get. But all that you need to take note of. If you notice anything wrong, come before, make them check out.
You notice anything, come, make them check. Don't assume, not just go over the counter and buy any medicine and say an antibiotic, apothec. So go to the master sabi people them, make them check the bobby, and yourself get for the observe yourself. So what are some of the causes then?
Wow,
they lead to this breast cancer?
Unfortunately, even the sabi doctors them and scientists no one great cause. They don't know why this person they get and why this no they get you know why this they die of and why this no they die. But then group something together where they call risk factors then. Now basically a fancy name for causes also, right? So let me just say the number one cause if you be woman. Why? Woman they get more bobby. And they get certain hormones them where they produce. When man they you know keep fenam de pandiman or a little pandiman, eh? Second could be where they old, where they age above 50 and all that. Because as you they age, all things by the system they reduce. You know, could get a strength today, your immune system they can't down small, that part of the body where they face infections them, and where the body weak and immune system is very low, and then time the cancer can grab. Then it can be back where they smoke boku beer, smoke tobacco, boku tobacco. Whether you snuff them or you they chew them, you know, all then tobacco can come in all that forms. Whether even in shisha, you need to avoid them as much as possible. And not only the person with the smoke, but the person where no they smoke,
non-smoker,
but sit down near the person with the smoke. Try to move away from that. It's very important. The way they drink boku beer. alcohol. As you say, the culture na salon, if they say pass you where you want enjoy, pass you jack, pass. It's crazy, right?
Yeah.
Well, that is a very, very wrong message people that they send out. Really, really. Alcohol, you know, get no nutritional benefits. Alcohol actually they reduce the people them motorman immune system. And remember, I say if the immune system they down, and they take cancer kill leg for grab, right? So and the other one back can be the environment. They say if not like 100% things the way they cause are 50% are the things with it around the environment. What I mean by things around the environment, radiations them around the environment, the grease them, the cream them, the lotions them, hair products them, what would they use for our body, then the food self what would they eat. Now the other part of the causes back, the food. What do I mean by the food? Not all kind of food by the way. Now highly processed food. And what I mean by highly processed food? Then food that where they don't go to manufacturing companies them, where they pass through that, where during the process of making the products then they add beaucoup preservatives, they add beaucoup coloring for change color or make them more presentable, they add beaucoup flavors them when are chemicals and when not some natural flavors them, they add beaucoup ingredients them, where even if you take the ingredients packet of biscuits, let's say example, you're not able to understand half of the ingredients with it because they use certain terms them, and most of these terms are not to best option for person may they eat for eating at the body that puts and so, but because they aim at profit making, they want to make the food them presentable and last longer, where you can see some food they're waiting at the shelf of the supermarket they can say it, where you know say food if you left an adult inside 24 hours they spoil. So you know, so now make it very important for adopt we more local foods them, where they grow na this country, and food back where no gets too much chemical fertilizers where they grow them. You know, then things that can cause problem. If now let's say for example tomato, we know say they take like about 6 months or 1 year for grow. Some tomatoes then inside 3 months they don't grow. Then they for be an alarm and a red flag to you because they add chemicals for fast growth. And if you look at cancer where if it affects the body, any part safe, not only the body, it grow fast and it grow differently. So even scientists they suspect say some chemicals them no fit for human consumptions them way it did and the food simply because for make boku for sell boku to the growing population again. The cream where they use, the locations them, even the cleaning products them, then things that we they use for clean the ground, brook we close them. So they get some chemicals them where recently people they become aware, and now manufacturers they know say people they become aware, so they pull their ingredients them and then chemicals them, you know, and then products them whether they call it clean products or they say paraben free, non-sulfate, all the things them get connection to cancer basically. So it's quite difficult and it really sad really. So basically, we did an exposure to them things, them right? But the best way for prevent them now for eat good food, mainly fruits and vegetables.
God to man.
Yes. And another controversial one are these hormonal treatments, then right, or therapy. For example, contraceptives, right? Yeah. They not say no use them. Okay, some people then they need them. Some women them yes. However, you can use them, and doctors always they prescribe them and instruct you how for use them. Most contraceptives they use them like 3 months, 3 years to 5 years, then you stop. Allow your body for go to that back to that natural biological process, right? But some women they say they begin to come this are the 10 years now they pan or the 15 years, and then in a long period of exposure to them hormones and we can disturb the normal natural processing of the body. So it's very important for take note also. It can be also through family history. If you auntie or mama, your papa side said when they get the man cancers them, and then tell them before you born that you inherit the gene, it can possibly be at that. But again, out of 10%, let's say out of 10 women that will get cancer, 7 of them no get no family history. So that's why we say the one that we no get family history, them boku pass the one that we even get the family history when are hereditary. So it means say anybody can be at risk of cancer actually.
Everybody they at risk of cancer. You know, mean say because that one and family get I mean say you free. Everybody they at risk. And we lifestyle, especially we where they na the city. We always feel say that when you go to supermarket and shop and you want get the best, you want eat tin sardine, tin lunch or meat, everything where they na tin, soft drink and all of them things here. For you don't hear you waiting Khadija say the preservatives where then they use. and na profit making. So eat the fruits of the season. Now orange them, eat as much as you can, and banana them, eat as much. And Mickey always tell people, they say, and one of the stands of the Catholic Church, they against the use of contraceptives. So the Catholic Church, they encourage women for partake in natural family planning, where now either you abstain or you are faithful.
Wow.
Abstain or be faithful. So if you practice and then you not get problem with the issue of contraceptives. So I can even tell them, when you they go feel say you are use contraceptive, you they put yourself at risk for 1 gray man.
Yes.
And then you get so many problems at the end of the day, obesity, hypertension, as the case may be, all of that in there.
It can cause some side effects.
So many side effects, and even delay return to fertility, amenorrhea, all of them problems there. So this is not the voice of Khadija Kone, the breast cancer nurse, and also a survivor Idenaya, for talk to we, for educate with the women them we negligent or we not feel for things say that important, because now we young with the past, we bobby the gear one or nothing say important for them. We check with safety now before glass and all. So as Khadija gets another program for go for me so we go try for wrap up the program. Khadija, go why you tell people they don't know what are the risk, the signs and symptoms, how people go try for the steps so we go take. You already named some. So which other steps then will be added to the prevention of breast cancer, and also outside they were able to locate the places them for
okay. So basically boku things and the way you go able engage pan and reduce the breast reduce your breast cancer risk. The one way actually now I do we don't help me a survivor. I catch me cancer with the early stage. Cancer get 4 stage 1, 2, 3 and 4. Me catch me cancer na stage 1. And doctors be so happy because then stage them, definitely treatment can be very successful, about 90%, 100%, right? So, but then at the left and last, I did mention them. Let me mention the other things then. So basically now, an opposite of the causes them or risk factors.
Yeah.
If you did smoke boku tobacco cigarette, avoid. If you did near person, advise them stop or move away from that person. If you did drink boku beer, avoid them. If you eat boku processed food or even fatty food, and even when I say processed food, even the one that we get boku salt, you notice that boku food then they get salt boku. Even the canned foods them, then get you see a bottle of can alone, like I will say example, like then soft drinks them. You sabi that cubed sugars them?
Yeah.
1 can get like 35 cubed sugar.
Wow.
You not gonna know because now water all thing don't melt. But literally not so it gets so much sugar. People just they gobble down. So people they take 2-3 cans them. They get risk of diabetes, but not only that, it also unblock the body then and leads to other complication or risk them like cancer. And like I said, it's more healthy food then, right? Okay. More vegetables and fruit. And believe me, inside salon, even the local food them, they're very, very healthy. God bless salon with lots of natural food them. More like we potato leaf. Permawe actually they say that the most healthy food na the whole of salon, followed by Lafidi. Believe me or not, then the rest they follow. Okay. All the plazas then good, then are leafy vegetables. But again, the way we prepare them, Nike make them unhealthy. How? What I mean, where they pass mat boku salt them, where they pass mat boku oil them, fine. Even the fats them. Now I see the trend there when I kanda. They can eat boku. Kanana ordinary fats. Yeah. Yes. Although it's sweet, I can eat one time more, but not one time, right? So you need for really manage and know how for eat and prepare them food into the healthy styles them as possible. Then exercise. First, when they exercise, they move in body. It can lead to even obesity where they eat too much unhealthy food and they exercise. Because obesity na the other cause where person get boku fat na the body. Now the other cause of cancer. Again, when they exercise, because when they exercise, you they engage your body pan boku good things then.
Like how you don't engage this after.
Yes, I feel much relieved. Like the way they exercise, they sweat, the blood they move, they kill the fats then in your body. They put them so they release the toxin then in your body. They help your lungs then breathe fast, forget oxygen. So you get lots of benefits the way they exercise. And lastly, now they come to the one thing which saved me life. Now they call breast self-exam.
Okay.
What did that mean? It means say you go able to check your body by yourself. The self mean by yourself. The exam. And you don't need any equipment. You only need your hands and the mirror. basically. But basically, like just your hands you need. And it take less than 5 minutes for check day or two, Bobby. Quite simple. However, not technically, not anyhow you touch.
Okay.
So woman they when our menstruation when they see their period, they need for check them, Bobby, 1 week or 5 days after the period.
Okay.
Not a when they depend the period, not a few days before the period or few days after. Now after, because why? Sometimes women didn't find the period, they get some signs and symptoms like cancer. Where if possible able check that time, then it go give false alarm, right? So it best because after the period, that time the body come back to normal.
Okay.
But if problems still there, and no come back to normal, then you need to take a closer look, right? So when you check your body 1 week after the period or 5 days, and you can check how you sit down, you sit up, you lay down. Anyhow, woman they will get big bobby, it best for me then lay down on the bed and then check them bobby. It's very simple, right? Let us say example now the right bobby I want check. I put the right hand over my head so for expose all the area. Then I use the opposite hand when I the left. 3 middle fingers, I put them together. You want to join me? So
yes.
I train you.
I want to join you.
So now you begin for massage. You put your fingers together. Begin massage the collarbone area. All the area na body area, long skin form there.
Okay.
You begin massage, then you go round the outside part of the body, right? Feel every inch. As you cut up, you go inside small, you go round again.
Okay.
You feel all over the body, even beyond the nipple. I will see some lumps that will hide behind the nipple. So after you don't check all over the body, now you can at your armpits. Can lump back in form the armpits, and but women don't end up for lost their lives because we lump can at the armpit, they ignore them.
Then something a boil.
Boil it take normally 1 to 2 weeks.
Yes.
If it resolve by then, but if you not resolve, now your problem. Feel under the armpits, right? Feel under the armpits for any lump when I see it. The last one now, in between this thumb and the index finger, you quiz the body mouth.
Okay.
For watch the kind of water where they come out. Mind you, some water is normal actually because of the hormonals, because of contraceptives, but not blood. If not brown, like with coffee and tea, if it make like snot, not a good sign.
Okay.
Mind you, we don't check one bobby,
Hey.
show love to the other one. Do the same thing to the other one. You do the same technique. You see, if I less than 2 minutes, you don't check your bobby. It's very simple, very effective. Now I get me lump. Let us say month 1, I check. I begin feel some kind of discomfort, not like pain, but you know I just ignore I'm facing on my period. Month 2, I begin check back and it make like it one thick. I say sometime I'm a period back. Month 3, the area be thick by smack. By month 4, now that time I feel lump. So it take a space of 4 months for get lump, but I be they check regularly, and now that make I able catch them quick. And where I go to doctor, where you don't test them, the results come back, they say, now early stage you do, no need for worry. You know they lost your bobby. So I don't end up for cut me bobby because for save me life. Unfortunately for women, they way they left lump or other signs and symptoms in the body for long. Cancer, one thing about cancer, it is spread. You know they tap one side. And the scary part now, what it common in the body. It can very difficult for treat. The treatment can take long and even it can expensive. So with best bet now, early detection. Do your body. And this example I don't show you so you for do it every month. Because why? You see period every month. Mind you, women back when they menopause, they even get cancer. So they can simply pick one day in a week. It can be the first Sunday or the last Sunday of the month and check for the rest of their lives. Same thing with the man. The same technique I show you, they for pick 1 month and continue for check. And the other step is when you they check every month, every 3 to 4 months, go to the professional medical person, make in check, because then equipped, then get skills them and experience for able to detect a problem where sometimes you no go notice an issue, right? So you can kind of think if you want to 32 Panama Road, you can go with woman, you can go Connaught Hospital, right? Then side and then get the savvy man doctors them, right, or medical professionals. We go able advise you to the best of your knowledge, to the best of their knowledge, and guide you in the treatment part. We go make them successful.
Wow. As time they catch we, that's the voice of Khadija Akone. Now it go tell we no more little bit how they can celebrate or how then they take note of this particular month as a foundation for raise awareness.
Wow. Thankfully, one man no more or one organization no go able to tap cancer.
Yeah.
It's very impossible. So we're so grateful and thank all we sponsors them, partners them, including Radio Maria, for giving with such for making them give with such opportunities and for reach wide and out to them. Boku people in a salon, because we not saying on the Freetown in one not to the whole of salon. We get Bo, McKinney, Econo, all inside them, and we want let this message reach to them. So where would they occupy radio stations like this? It's very good, and thank you very much. This go make person na the village side where they listen radio. If you listen, if you get this message and you go act upon. Then also when they go schools then, when they see say boku young girls then they get this sick. Yes, them boku. This month alone, we don't check over 2,000 school girls them. We go different schools then. And believe me, 68 out of that 3,000 we see say they get lumps. And most of them because of they don't get money. So we engage in fundraising activities also, which don't pass, but we still encourage people then for Medican I think keep it 32 Panama Road and donate. Orange Money they went at 078 611 733 made and donate because they can't boku. They need help. We also go to corporate institutions and boku banks them and other businesses. They don't invite with the managers and they don't invite with for can check all them staff them Bobby and educate them, and it's very good because a manager like that will go down bring that initiative or invite me. It means say he very care about the staff them well-being and productivity, because when person well he able become productive to the company as compared to a person not well. And moreover, we don't go to like villages them, we don't go to corporate institutions, we even go to churches and mosques. Yes, because it's very important for involve each and everyone. Breast cancer exam na a life-saving skill, and we believe each and every woman are the right for no.
Each and every woman now you right for no. Demand them now na right for no. So Thinking Pink Foundation and all the organizations there where they help for raise awareness about breast cancer. One for tell una boku thank you for all the activities una done in this month of October and all other months. Una set this month aside and miss all the challenges they wanna get. As I say, Khadija late for Ghana the studio because we get an emergency for attend to another patient where we need help immediately, and so that's not the job, that's not the profession. One for say tell you boku thank you on behalf of Radio Maria and the Wel Bodi Tok program for let you can share your experience with women the way no one accept or they not believe or they not ever know. And you self we don't follow this program, please like and share the program as much as you can. You never can tell you are saving a life. So we want to tell Khadija boku thank you. As I say, Khadija Kone na a breast cancer nurse where they work na Thinking Pink Foundation, and in same way so na a survivor because it detects the condition early, able for go over that. And here she is to help us and to help others, and even the one that we not sabi it. So we want for tell una thank you for following, and this repeat session will come up on Wednesday and other more programs then they come. We want for tell Khadija thank you again, and I know say people then go down send more questions, but because of time we go able for answer on our questions then later, or if more questions then they or clarifications then they Khadija go announce the address one time also then go.
Okay, we did 32 Panama Road, Wesley Street Junction, or sometimes I can call up AYV Junction.
Okay, AYV, yeah, the road for go up AYV. So that's the voice of Khadija. We want for Teluna Tata. We left on in the name of the Father, and of the Son, and of the Holy Spirit. Amen.